Hello everyone, welcome back in clinic conversation with me, Suresh Sudala at KRIDA Harley Street. Today we are going to talk about arthrosomid and role of arthrosomid in treating knee osteoarthritis patients. What is knee osteoarthritis? Let me put it this in simple way. Everybody thinks it's a disease. It's not a disease. It's a natural wear and tear process, the degeneration process that every individual goes through, where the cartilage is worn out depending on the lifestyles, depending on the excessive load, and sometimes depending on the impact and then trauma one experiences. The main symptoms of knee osteoarthritis is persistent pain, inflammation, swelling, stiffness, and to a degree it impacts your day-to-day activities such as walking, climbing stairs. If one has not responded to non-surgical managements, including lifestyle changes, exercises, weight management, medication, and simple injections, and then pain is persistent, it's impacting significantly the quality of life, yes, there are surgical options. Varies from simple arthroscopic washout to osteotomy, partial knee replacement, and the total knee replacement. I would always recommend exercise, activity modification, lifestyle modification, less impact, physiotherapy, weight management, and you could also try some simple painkillers like analgesics, anti-inflammatories if you're allowed. Followed by that, you can also have a simple, safe, minimally invasive injections. That could be a simple steroid injection, hyaluronic acid injection, biologics, and more recently we've been using arthrosomid injectable implants. Arthrosomid is a non-surgical injection option to manage osteoarthritis. It consists of 2.5% polyacrylamide gel and the remaining is pure water. It's a single dose injectable implant which offers sustained pain relief for up to 3 to 5 years. It offers cushioning and lubrication to the joint. And then it works as an anti-inflammatory scaffold to the whole knee joint. How does the arthrosomid differ from other injectable? Firstly, it's not a drug. Secondly, it's not a biologic. It sits between those two. It's an injectable implant. It creates the layer of scaffolding around the synovium of the joint, provides the lubrication as well as the cushioning effect, and provides an anti-inflammatory effect which lasts long time, up to 3 to 5 years. If you're coming in to have arthrosomid injection here at KRIDA Harley Street, the appointment lasts about 45 minutes to an hour, where we initially do a consultation, perform a diagnostic ultrasound scan. If the scan shows any fluid collection within the joint, we would take the fluid out before we inject the arthrosomid gel in the same appointment. The recovery from arthrosomid injection is fairly quickly. Some people, it can take up to 2 weeks, but we usually say 2 days to 2 weeks. The response rate from arthrosomid injection varies. The average responder takes good 4 weeks to notice the difference. There are early responders who can get the relief within a couple of weeks. At the same time, there are a tiny proportion of people takes up to 12 weeks. We classify these patients as the delayed responders. If arthrosomid is successful, which is about 70% of the people we perform the procedures benefit from these injections, it can offer you good up to 3 to 4 years, and the latest study which showed up to 5 years relief. Now, first patient who I injected was back in May 2022. Fortunately, it worked for her, and then she's doing extremely well. So I have done over 300 procedures using arthrosmith hydrogel injection. I have a very good experience, and that's the experience I share with my patients. Yeah, and the one thing which comes into my mind, this young chap who is late 40s, who's been suffering with patellofemoral as well as the tibiofemoral arthritis. He had, again, all the surgical interventions he could try, the arthroscopic washout, and then being very young and then in a persistent pain. He also tried steroid injection, which only lasted short periods. For him, the main expectation from treatment was ability to play cricket during summertime and then have that persistent pain relief. Fortunately, I injected him about 6 months ago. He's doing extremely well. He just sent me a message. He played 6 matches and scored half a century, and he's doing rather well and is very happy about this treatment. I've used this particular lady who came to see me from India. The main complaint was climbing stairs and playing with her grandchildren in the garden, as simple as that. She tried other treatments, other injectables like steroids and the hyaluronic acid, which offered a short-term relief. And then following a very detailed discussion and informed consent, she had this arthrosmith hydrogel injection. And fortunately, it helped her, and then she's comfortable climbing stairs, comfortable walking around, comfortable playing with the grandchildren in the garden with a less pain. Again, we always say you don't have to be a sports person to be treated like one.